Daily alcoholic mouthwashes can increase the risk of type 2 pre-diabetes.
Anything dead in the body collects bacteria. Bacteria releases a toxin which could affect your general health.
In Alzheimer's disease, you find an oral bacteria that shows up in gum disease, and it's in the brain. As soon as we move ourselves off traditional diets, we begin to see dental diseases.
Let's talk big picture and a little bit of the history of tooth decay.
Yeah, Drew, it's really interesting because, in dental school, you're taught about tooth decay as, it's almost like it's written, and that, that we understand tooth decay from, right through how it happens and the cause. And, we know that sugar consumption is associated with tooth decay. But, when you look back in the history of, what we've understood about decay, there's been a bit of a flipping, of the philosophy of where we think tooth decay comes from. And it's fascinating. I only recently in the last few years began to start to look at this. And my work with teeth has always brought me back to understanding what our ancestors did, and, what, some of the older literature talks about in terms of what we understand about our dental health and what that shows us about the body. So what we used to, the first, in Greek philosophy, when we used to talk about decay, when they used to, wonder why, why decay happens. This was actually founded on the idea that there was something happening inside the body. So people were having these rotten teeth, and there was the idea that we have tooth worms. And so, we have to remember that the foundations of medicine was formed in the Greeks. And so they were the first times when they were writing about, and they're looking at patients and saying, why is this happening? Is this, well, they think there was a worm, like a parasitic infection in the tooth. And, that seems, quite strange for us, for quite a while now. But when we start to look at what's happening, with what we understand about the biological processes of mineral balances in the body, it actually, our perspective is starting to shift back into the body. And so what happened in the 17 and 1800s is that this idea that something was happening inside the body was thrown out. The biological and the outside factors, so the saliva and the more infective factors, began to become a focus as to the cause of decay. And that's really where we, in our modern perspective, we're sitting. And it was only in the 70s and 80s that the microbiological, theory of decay, where there is an infection of Streptococcus mutans, which is a fast metabolizing bacteria, eats sugar, releases decay. That was, kind of what my dental education was founded on, where we have, this infection because we have sticky plaque on the teeth, and then the bacteria eat away at the tooth because of acids. And, that was really kind of playing into this, 17s and 1800s, theories where tooth decay is coming from the outside. But since then, we've really kind of shifted into a more detailed understanding of what's happening with mineral balances in the body, what's happening with bone metabolism. And, the understanding of the oral microbiome shows us that there's millions and millions and millions of bacteria living in the mouth. And so just this infective idea of tooth decay started to, not make so much more sense. And then in the last 10 years, once the idea of the oral microbiome popped up, we began to see that, hang on, it's imbalances, and bacteria are doing things, and they're managing minerals in the body. Plaque and bacteria actually exchange minerals and calcium. And this is a biological ecosystem that we are living with. And then so that begins to show that, hey, hang on, these bacteria also live in the gut. They speak to the immune system. The brain is monitoring what's happening in the mouth. And we're now beginning to see that, well, actually, there are nutritive factors to this. There are underlying comorbidities with tooth decay that, relate to what we eat. And we can see that, this is happening inside the body, not just the outside.
Yeah, it's really powerful. It's sort of like graduating the understanding around a very simplistic idea. Hey, sugar, causes this decay, to a more complex idea, which is not all bacteria is bad. We have the whole germ revolution where we thought germs were all bad. And then now we know that germs are actually, not only are they good, but it's more likely that we are the host for them rather than the other way around. They're using us to get their job done. So take us to the next stage there. So now that you mentioned a few things there. You talked about the exchanging of certain types of minerals and vitamins that were there. So complete that theory with what you understand now, and what earlier you were saying we a lot, but really what you're talking about is the biological and functional dentist community. It's still not very well established in traditional dentistry, this idea of what you're talking about. So complete that theory of what you know now contributes to the tooth decay.
Yeah, it's a very disparate picture, and it actually speaks to how we disconnect the oral medicine with systemic medicine. And so the evidences that we understand with diseases in the mouth, they are very disparate from what medical doctors are treating patients with systemic issues. And so that problem starts to, it really disseminates through society. And then so you have the functional medicine community that looks at root causes and starts to think about why lifestyle, habits and diet and so forth, affect and cause chronic diseases. But dental diseases are very much the same, and they're actually connected. And so when you start to look into how functional medicine and how understanding nutrient deficiencies and so forth begin to play into what we see in the mouth, it all starts to paint together. And so it actually goes back to another older text which I based my first book on, Weston A. Price, and he went around the world and he looked at what happened with traditional diets and what happens with modern decay. And he found that as soon as we move ourselves off traditional diets, we begin to see dental diseases. This happens in the anthropological records, and it happens in modern populations as well. This was in the 30s that he was doing this. And so what he did was he looked at the differences in foods, and he found that there was a specific lack in fat-soluble vitamins that arose in the which caused the rise in decay. So up to 30%, which is the modern rates that we see decay, and they're going up now once we remove these factors from our diet. And so what he was talking about here was vitamin D and the fat-soluble vitamins. And what we've learned in the last 20 to 30 years is that vitamin D that we absorb through sunlight, but we also get from food, is a primary manager of minerals in the body, so calcium specifically. And it's how we absorb calcium. So when we're vitamin D deficient, we don't absorb calcium in the digestive system. So you can eat as many foods as you like with calcium. So proteins, plant-based foods with calcium. If you don't have vitamin D, you won't absorb it. It'll fall straight out of you. And then it's the management of these minerals, so calcium itself, how it gets into your bones and teeth. Now, vitamin D is a hormone regulator. It regulates our DNA. And so what we now know is that there are thousands of cells all over the body that are listening, that have vitamin D receptors, and that are listening to the vitamin D in our body. And so when we're vitamin D deficient, we have an overall message to strip minerals. And this is kind of just the surface level as to how our diet, how our vitamins, and how our endocrine system manages the nutrient balances in the teeth. And recently, so in the last 10 years, what really kind of opened my mind to this was what we're understanding about the microbiology of plaque. So we mentioned before that plaque and calcium interact. So the reason why you get that calcified plaque built up on the back of your lower teeth that your dentist cleans off. Now, there isn't a good physiological explanation for that. So the dental community says it's due to poor oral hygiene, but actually it's due to the body not managing calcium. And we know that there are proteins in the mouth that carry calcium into bones and teeth. And so these are fat-soluble vitamins that work synergistically with vitamin D. And when vitamin D absorbs calcium, it needs these other nutrients, which is vitamin K2, to carry calcium into bones and teeth. And so what the studies actually show is that tooth decay is actually a deficiency in calcium in the mouth. It's not actually just the the stickiness of plaque on teeth or the overproduction of acid from certain bacteria in the mouth. It's actually the lack of calcium. And so what bacteria will do is they move into teeth to strip the minerals, which is what tooth enamel is. It's frozen minerals, calcium, phosphate, and the bacteria actually need this. Calcium is involved in every physiological process in our body: muscle reactions, cell reactions, brain reactions, and bacteria need it as well. So we're actually seeing an imbalance in the way our body is moving minerals around.
And it's so crazy about Weston Price because, I mean, what year was his work and his books published? It was how many years ago?
In the 30s. So yeah,
in the 30s, in the 1930s.
Yeah.
I just had on, we were talking about her, but I had my personal dentist here, Dr. Rashtian, on. She said, he was a genius that was just so ahead of his times. I mean, people were back then like, you got to be crazy, because modern dental health is associated with prosperity and the rise of the economy. And we often thought of people not having access to dental health and dental insurance and dental care prior to the modern day dentistry as being sort of savages in a way, you could say. But Dr. Weston Price, as you mentioned, was looking at these modern day hunter-gatherer societies that were still living the way they were. They didn't have dentists. They didn't have toothpaste. They didn't have Colgate. They didn't have all this stuff. They weren't flossing. Sometimes they were chewing on different types of sticks that had a flossing-like effect there, but their teeth were perfect. And that's a big part of what he was outlining until, and he documented this as well, they would start to transition to more of the industrialized process. Now, all of a sudden, tribes members and individuals who had great teeth within a few years were having incredible decay. And I saw this firsthand. I mentioned this before in a podcast. I went to Kenya with a group of my friends, and we went and stayed with the modern day hunter-gatherer group called the Samburu. And we saw how individuals as part of that tribe who had kind of branched off and had been living in kind of more modernized Kenya, who had been eating the more industrialized diet, would start to develop severe dental issues. But even the elders who were part of the tribe that had been living this way and eating their traditional foods, they had never seen a dentist before. They actually don't know how old they are exactly, but they were guessing somewhere between 65 and 70, somewhere around there. Their teeth were perfect. And you just don't see that here in the US.
No, you don't. Tooth decay is the most common chronic issue in children, and it affects up to 50% of adults. You don't see those rates until very, very recently. When you look at the skull records, when you look at people that lived on the land traditionally, you see it in Australia, you see it in New Zealand, you see it right throughout South America, and Price demonstrated this. And what you saw, was that quite recently you went to Kenya and you saw that?
I was there. Yeah. It was about, I would say 3 years ago, 3.5 years ago.
Yeah, I remember. And yeah, so that's exactly what Price did. He went around the world and saw the exact observations that you did. And it's amazing that we've lost this perspective. And when we see decay in our children, when we see, a hole in our tooth ourselves, there's a lot more, to answer for than just, that there's some sugar, building up some plaque on our teeth. And so, yeah, it really teaches us of a lost human art of understanding how the body works and how the mouth connects into, the systemic issues that we suffer as well.
So you mentioned a few different vitamins that were there. You talked about, vitamin D and A. You didn't talk about too much about vitamin K, but I know you've written about that as well, and how the link between vitamin K and vitamin D goes hand in hand. And you also have talked about in your writing, in your article that I read, about collagen. So give us a little bit for people who are like, well, I eat really healthy. I eat healthy. I have grass-fed foods, things like that. How could even people who think that they're eating really healthy be sometimes deficient in this? And as a byproduct, their dental health is suffering, and they can see that firsthand, that they might see that tartar buildup when they're going to the dentist, or they still might be experiencing things like cavity, even if they're not having a lot of sugar in their diet. Because I know when I switched to being vegan and started to cut out like sugar in my diet and started removing things that I felt that weren't that healthy for me, like dairy and gluten and other things like that, I was still having cavities that would pop up on a regular basis. So how are even people that think that they're eating healthy, what are the things that are going on in their diet that they might be missing some of these foods and these vitamins that are so important to oral health?
Yeah, and so when we look at traditional diets and what has changed, so why we're observing these shifts in people that traditionally didn't have decay and what we eat today, there is a specific lack of fat-soluble vitamins. So the foods that carry these nutrients are the food we just don't eat them today. Unless you eat organs, unless you eat grass-raised dairy, which is very difficult. Even today we don't. It's very difficult to get these foods that are raised from pastured animals, and these are the foods that our ancestors ate. And so when you don't eat organs, and even the different types of organs, the most nutrient dense food on the planet is liver. And the reason is because the liver is the organ that carries these fat soluble vitamins. So when you eat a food with vitamin D, for instance, it has to be assimilated and absorbed into cholesterols that are carried and directed around from the liver. Now, when you eat this from an animal, you absorb all of these nutrients that they convert into the active form that we humans eat. And so unless you have a diet rich in these foods, which we really just don't, I've been trying to convert to this type of diet now for many years after writing and seeing what this effect is, and it's difficult. In our modern world, it's very hard to go to a supermarket and pick up a nice pate or a slice of liver. You have to go out and really make an effort to talk to your butcher and talk to where you can source some organically raised pastured organ meats. Very difficult. Then you have to learn to prepare it. You have to convince the people around you to eat it, or you're just eating it by yourself. People today, we just don't do this, and it is a very disparate change from what our foods used to be. So when we don't eat these foods, when we're deficient in vitamin D, and this is a baseline, we'll go into more details, but just as vitamin D is kind of the baseline, so that's where I kind of start with talking about, is that up to 80% of the people now are vitamin D deficient. And we've seen that when there are studies both in, there's one in Russia and one in Africa, where they take traditional societies off their foods and they measure their blood vitamin D, and it decreases. So today we're measuring our vitamin D levels, and these are the things that are exactly managing the mineralization of our teeth. And when we're deficient in these things, our teeth don't mineralize. And we have to remember that teeth, it's a long game. It's a crystallization. So when crystals and rocks formed in nature, it takes thousands of years. For your teeth, your baby teeth start to form in utero. And we know that vitamin D deficiency from a mother translates to the newborn child. And so and when we're a population 80% deficient in vitamin D, this is going on to our next generation. Now, a child's teeth won't erupt, till they're roughly 6 months or so. But then once we see that sometimes there's a cavity forming, that's a long-term deficiency. Fat-soluble vitamins and minerals take a long-term time to form in the body. And so between 1 and 3, then the adult teeth start to form. So if a child has holes in its baby teeth, then by the time it's 6 to 12, these might fall out. But if they have deficiency between 1 and 3, when the adult teeth are forming, then the adult teeth come up, and then you're going to have a hole in the tooth. So when we're looking at tooth decay, we need to think long term what has happened. And for instance, you can get markings on teeth that are due to deficiencies, or for instance, infections. If the mother has a fever, then a child can have a mottled enamel or a white kind of a white speckling on the enamel due to the fever at that time. So what's happening is the body is placing minerals, and so it's using and sequestering these nutrients and minerals, and it's putting it together to form the tooth structure, the hardest structure in your body, used to chew and grind meat and food. And it's a very resource heavy process, and it's also a very reactive process. So it's constantly mineralizing and demineralizing. Once the tooth erupts, the enamel is exchanging minerals with the saliva. So saliva is full of minerals as well. So we need to think of tooth decay to start with as a long-term deficiency, and that, because I think people are a bit hard on themselves when they have tooth decay, and they think, oh, I've been eating so healthy. Like, I've even seen parents who have been, eating a diet that are, even through pregnancy, and they still have children with holes in their teeth. We're in a generational problem now, and people just need to take that perspective. We need to step back a bit and just understand that teeth and bones take a long time to heal, and once we get on that road, it will take some. It can happen, but we just need to understand that it takes a long time.
Yeah, it's not like the problem wasn't caused overnight, so it's not going to be fixed overnight either. So let's get into the next aspect of this. Well, I actually wanted to chime in one more thing. The old Dhru, who was vegan, the idea of eating organ meat would have been like crazy, to me, like, organ meat, like, what are you talking about? Like, is that actually a thing? And as you go down this rabbit hole and you start to learn a little bit more, we've had researchers and physicians like Dr. Terry Walls on the program. And she talks about when in her Walls protocol, which she uses to help MS patients significantly reduce, and in some cases, you have to put in air quotes, reverse MS, because the symptoms have gotten so much to a degree of being suppressed that it doesn't feel like they have the disease anymore. When people have gone through that and other autoimmune conditions, in her discovery, she was doing all these different aspects, and she felt that what took it to the next level was the inclusion of organ meat. What took it to the next level of healing for her was organ meat. And anybody who wants to listen to that, we'll put the episode in the show notes below. And she talks about that in detail, about how that, and she also was a vegetarian before as well. Let's jump into the next component. So you mentioned something which was, it takes a long time for these deficiencies to build up. So going back to the title of this episode, can we actually do something about it? And how long will it take to then reverse course for some of these decays or bad oral health that we're seeing?
Yes. So with tooth lesions, with cavities, there are three aspects of the tooth, of the anatomy, and that's the enamel, the dentin, and the pulp. And so the enamel is the outer layer, and so that's the most mineralized layer, and that's laid down by a special set of cells when the tooth is actually under the gum in the bud stage. And so what happens is you can't actually, when enamel is destroyed, you don't have the cells there to remineralize it. So I've never seen enamel regrow, as a sense. But dentin, in dental school, they tell that you're taught about the histology of reparative dentine. And the reason is that, so dentine is a less mineralized version of enamel, and it's underneath the enamel, and it's connected to the nerves and the pulp, so the blood supply. So it's the living, breathing part of the tooth. Now we know that dentin with a carious lesion can repair itself, and the reason is that in the pulp, inside the tooth, where there is a nerve, where there is an artery supply, where there is a lymphatic supply, so the tooth is draining toxins as well, and so what happens is that the body can use their bone marrow-like cells, so they're called odontoblasts, inside the teeth. And so odontoblasts run on these fat-soluble vitamins, and they can lay down reparative dentine. It's not quite like the old dentine; it's like a hardened layer. And so what happens is, we know this happens, and so, but the body has to have enough of the nutrients in order for this to happen. And so the dental industry knows that dentin can repair, but we haven't talked about the physiological ways that we get it to do that. And so when you change a patient's diet, and so the way that we can kind of track this through, back to understanding what's happening in the body to a lesion in the tooth, is that we need to start thinking about the biomarkers that the body needs to repair this. So if you have tooth decay, you need to be thinking about your vitamin D levels, because if you're deficient in vitamin D, it's going to be very, very difficult for your dentin to be able to repair itself. And so people think about topical factors, but we're really starting to see that there's an internal message, both from the brain. The brain is managing minerals, just like it manages the the density of your bones. So when we are vitamin D deficient long term, we lose the density in our hip bones, in our femur bones, in our spine. The same thing happens in our teeth, and that's all run on those nutrients. And so there was a study actually in the 70s and 80s and 90s that showed that when you put a radioactive dye injected into a rat, you can detect that molecule in the mouth. So that shows that in the bloodstream, a nutrient will transfer into the teeth. And what the researchers actually did was they showed that you can reverse the flow from inside to out to outside to in, just by giving the rats a sugary diet, a high sucrose diet. So what happens is when they eat a simple carbohydrate load, the flow moved from outside the teeth to in. So, and they showed that when this change happens, the teeth are more susceptible to decay. And there's a management of the saliva via the parotid gland. And so what's happening is that when these nutrient levels in the body are sufficient, the brain and the body and the tooth itself, the bacteria, all work together to remineralize anything that's happening in the mouth. If there's a certain overload of certain bacteria in the mouth, then it can repair. And in the dentin, there are tubules called dentin tubules. They're little tiny tubes that they're actually, enamel is structured the same, and bacteria are running up and down. And what's happening is that the body's calculating what's happening with the bacterial load in the mouth, and it can counter these things. It can let out immune reactions. We have immune responses in the saliva, within the teeth as well, and it can actually absorb any toxin via the lymphatic system. Now, the lymphatic system drains from outside in the face to down into the veins, and then clears those toxins as well. So if you have a stuck lymphatic system, that's going to block these systems as well. So we can start to see that there's a shift between when a bacterial problem happens in the mouth, the body does have the ability to repair it, but we need to understand all the factors that go into that.
Yeah, and it really helps understand that how all these things orchestrate and work together. Fixing the teeth isn't about a local intervention. And we've thought about it for a long time as a localized intervention in the actual mouth. It's actually, we have to think of our teeth like other, like almost like an organ inside of our body, right? Like you don't eat a particular way for your heart health. Like the best diet for your heart is also the best diet for all the other organs inside of your body. And so that's how we want to be thinking about the teeth as well too, is what I'm hearing and understanding from you. So talk a little bit more about the oral microbiome. And, we've done a lot of episodes on this podcast about gut health, but how can other bacteria like Candida also contribute to the acceleration of decay inside of the mouth?
Yeah, so we know that there are certain bacteria that are present when we have decay, and these are associated with simple sugars. And we also know that there are protective bacteria in the mouth too that allow us. They release certain factors that will downplay these potentially harmful bacteria, and these bacteria live in the mouth normally as well. Now, what we also know is that there are many, many other types of microbes living in the mouth, such as fungus, such as even viruses, parasites. All of these things live within our mouth. And so what happens is there are many different types of decay, presentations. And so one type is extensive caries across many different surfaces of teeth. So when you often have the lesions right across the front of the teeth, often in children's quite tragic. But what they've shown is that in these types of cases, there is often a concurrent overload of Candida albicans in the mouth, and this is the cause of oral thrush. So when you have little red lesions on the side of the mouth, or you have white lesions inside the mouth, that can be due to oral thrush. And so this is an overload of this fungal infection. And what happens is that it happens in, for instance, immunodeficiency. When you have AIDS and so forth, you have oral thrush often, or severe cancer patients, they have oral thrush. But what it's showing is that if we don't manage the microbiome, so the oral microbiome, which is a very, very, we don't really understand what's happening with these type of microbes in the mouth. When you lose the defense factors of fungus in the mouth, it seems to overload. And Candida albicans is associated with sugar consumption. So it seems to be a concurrent imbalance in the oral microbiome. There are other factors too. Yes, we do need to reduce the simple carbohydrates. We need to put the defensive factors in. We probably need to think about how we manage the fungal microbiome too. There are medicines that have been used for thousands of years, and you started to talk about how teeth are organs. Well, in Chinese medicine, they specifically show how teeth are connected to organs. And another pattern of tooth decay is where you have, and this is the most common pattern of tooth decay I see in adults and so forth, is you have one tooth that is rotten nearly right to the root, and the rest of the teeth are fine. And in the microbiological sense, that doesn't make a lot of it doesn't make sense. You just have,
it's like, why would it just happen to one tooth?
Exactly. And that shows that there seems to be an internal deficiency or a problem that has caused the immune system inside the tooth. There is an immune system inside the tooth to fail. And so that's the most common cause of, or common presentation of decay. And in Chinese medicine, they say that each tooth is connected to an organ, and I haven't got to the level where I'm practicing, connecting all
the dots.
Yeah, right. But when you ask people about when they have what I'm doing now is when someone has a lesion, we get their full medical history, and you'll often find if there's a pancreas problem, or if there's a sinus problem, it relates to certain teeth, digestive problems. And so they'll often say, oh yeah, I have an issue that I'm dealing with. And it seems to relate. We're not there scientifically yet, but it's still painting this picture of an internal contribution to decay.
Let's jump into this topic here.
Sure.
Right? Let's start off with the basics for individuals. What is a root canal?
So root canal is a procedure that is done by a general dentist or an endodontist who happens to be a root canal specialist. And basically what that means is once they find that the patient has pain and they announce that the nerve is damaged and they cannot heal it, they try to save the tooth by just removing the damaged nerve from the inside of the tooth, which basically means you're not extracting, you're not removing any part of your tooth structure. You're going to have it as whole, except the nerve inside the tooth that is acting up and is causing pain, or is sending a message to brain, hey, I'm uncomfortable, there's an infection there, or there's pain going on. They remove that nerve and the blood vessels. So in other words, it becomes a dead tooth, because as we know, any part of our body, if you don't have blood supplies and if you don't have nerve intervention, it's considered dead.
Right, because it's not getting oxygen, it's not getting nutrients. It's almost like chopping off your hand from the rest of the body, but still sewing it and kind of keeping it attached, but none of the nerves or anything is going there. So now you just have this like dead hand.
So this procedure has been practiced for many years, and patients are happy because they get to keep their teeth. And if they have
the primary
pain,
motivation, right?
That's the
they want
primary
to keep
motivation.
Their teeth.
Exactly. Now that thankfully, most people can afford dentistry as opposed to past that even if there was a small cavity, people would adamant about pulling it or removing the tooth rather than filling it. People can afford dentistry. They're more conscious that they want to save their teeth. So they go to any grounds possible to do that. So root canal is one of those things. So everyone is happy. I don't have pain. I get to save my teeth. But at what cost? This is the part that majority of the people don't know. What happens when you have root canals? So again, this is the only area in medicine that we allow, and that's just because maybe dentistry and medicine was so separate for so many number of years, that we allow a dead part or dead organ to actually still stay in the tooth, in our body. So let's use an analogy. When someone has uncontrolled diabetes and there's a poor circulation to their appendages or fingers or toes, if they don't improve that and you cannot reverse it, then the poor circulation causes the dead tissue and then ultimately leads to amputation of their leg. They don't get to keep it. And why is that? Because anything dead in the body collects bacteria. Bacteria releases a toxin which could affect your general health. So we know that for the rest of the body. And
it's well established in many other areas. It's well established,
exactly. Except in dentistry, somehow we find it okay that it's all right to have a dead organ, the tooth structure in the body. And as long as the patient does not have pain, that's okay. So that's the standard. That's the criteria of a successful root canal. Does the patient have pain? No. Or if we take a two-dimensional x-rays, do we see a lesion? If these two answers are no, that's automatically a successful root canal.
And just to add to that a little bit more is that not only is it the only area, but also people still think of the teeth as not living. The teeth are living.
Exactly.
They're living, breathing things. They're not just like a piece of bone that's sticking out of you that is not attached to anything, is not doing anything. It's not just this solid structure. It's living, it's breathing. It requires regular nutrient supply. Like it's an actual thing inside of our body.
100%. Absolutely. And so again, going back to that criteria of not having pain, I like to use that as use an analogy that a lot of times, a lot of circumstances, we don't experience pain, but that doesn't mean there is not something going on in our body. Let's use cancer, for instance. No one wants to have cancer. That's the word that terrifies everybody. But when someone is on stage 1 or a stage 2 cancer, oftentimes they have no pains or symptoms. In fact, that's why a lot of times cancer goes unnoticed until accidentally somehow it's found. People that are lucky that at the early stage we find them because of this routine screenings that they do. Otherwise, it's not due to pain. But does that mean cancer at stage 1 or 2 is allowed, or is that okay? Is it okay to keep it once you find out you have cancer and not do anything about it because you don't have pain? Not so. So why is it okay to have a root canal that just for the sake of, well, it's not causing pain on the patient?
Right. And so the connecting the dots is basically when you have this root canal, you're basically severing the tooth from these nerves that are there.
Exactly.
And now the patient feels better because they get to keep their tooth, but they no longer have pain.
Right.
Right. But what you're saying is that just because you don't have pain doesn't mean there's not something that's lurking there. Just like my mother, who is also a patient of yours, when she was diagnosed with breast cancer, it was early, knock on wood, was caught early. She had an incredible team of doctors to work with her. But even though she was early in stage 1, she didn't notice anything. It was only because she felt a lump. There was no pain. There was nothing that was going on. So the connection you're making is basically just because you're not having pain doesn't mean that there's not something that's a larger health issue to address there.
Right, which could have an overall impact in the future or cause an issue in the future.
So can I ask another question?
Absolutely.
Let's even backtrack a little bit further. You know, so much of your work in dentistry is preventative, right? Help us to a place where we don't even have to get there. So, you know, I can understand why somebody comes in and goes to their dentist and says, listen, I've just been having this tooth pain. It's been days, turned into weeks, turned into maybe months, and people aren't going to the dentist or they go in their next checkup, and then dentist decides. Now, what are ways to even, what are ways to even avoid that happening in the first place before we talk about all the things that can go wrong when you have a root canal?
So how do we avoid root canal? Very good question. So there are 4 factors that I have in mind that 3 of them are very much in the control of the patient, is unavoidable, is very much avoidable, excuse me. There's only one factor that is unavoidable. So the first factor would be nutrition, diet, proper diet. So if you're having, if you're consuming sugar, or refined carbohydrates, and causing change of pH in your mouth and creating an acidic environment, so that's one of the factors, because the acidic environment can cause the enamel to become more soluble, hence more prone to cavities. Second would be the bacteria, your oral hygiene. Do you get your routine dental care? And who establishes that? Is it based on, I hate to say, your insurance companies that says everyone gets a cleaning twice a year? Does everyone's body functions the same or has the same need? No. A dentist has to establish a guideline and a time range for you to get your proper dental cleaning. Now, everyone in my office has its own formula because everyone's body's need is
personalized
different.
Health.
Absolutely. Someone has medication, the salivary flow is different, their diet is different, their hygiene is different, their orientation of their teeth is different, they have certain habits, they play certain sports. All of that is a factor that one has to keep in mind and establish for bringing the patient back, how often they have to come back for dental cleaning, so we make sure we are in control of the bad bacteria of the mouth.
Right, because we've talked so much about gut health, and there's also these other areas. There's your oral microbiome,
exactly,
right, which is what you're talking about.
Right.
There's a nasal microbiome.
100%.
There's even some evidence of the microbiome inside of the brain, which is being more established that's there, but your oral microbiome is just as important as your gut microbiome.
Exactly. So those are the first 2 factors. Third would be patients that have certain habits of, for instance, clenching and grinding. Number one, we have to find out what's the source of it. What's the reason for the patient that is clenching and grinding? Until that's established and hopefully taken care of, we need to prevent the damage, because you can have the best hygiene, you can have the best diet. However, if you clench and grind and put so much pressure at night and you wear off your enamel, your tooth structure, you are weakening the tooth structure and you're getting yourself to potentially at the risk of either breaking your tooth or causing hairline fractures. Now, through these hairline fractures, again, bacteria can travel inside the tooth. A perfect tooth can end up with a root canal for no reason. We see that often a lot. Patient that is a clencher and a grinder has gone unnoticed or without treatment for a number of years, and they ended up needing a root canal just because of the hairline fractures that was on the teeth, and unfortunately is irreversible now.
Yeah, it's like basically like every time you sit, you're sitting on your arm instead of just sitting on your backside, and your arm is twisted. You keep on putting pressure, eventually there's going to be some sort of break or exactly, a snap. So that's happening there, and that's really interesting because, you know, there are different interventions that can be brought into that. One is, you know, looking at whether or not somebody's breathing through their mouth at night, and there's some interest in that growing category of mouth taping and addressing that.
Right, which we talked about in previous episodes.
We've talked about previous episodes. And there's also, like, I've found that, you know, in my own life, I came and saw you at a time where I was going through, I live a very stress-free life, but I was going through something in my personal life at a time where I was having a lot more stress than normal. And I didn't think it was affecting me during the day, but it was definitely affecting me at night. And not only was I grinding my teeth, but I also was biting my tongue. I came to you and I said, I'm like weirdly biting my tongue at night because of this grinding that's there. And you had recommended some interventions, including at the time, you know, Invisalign was one of the things, like a mouth guard that was customized towards me.
Right. Well, some cases is the occlusion or the way the teeth come together is a factor, and that makes them a grinder or more prone to clenching and grinding. Jaw structure, the shape of your jaw can dictate that. That's why we get that. It's genetic. It comes from our parents. So a lot of times when a patient is a grinder, either 50% chance one of the parents was a grinder because they get the anatomy of their jaw from either of their parents, or any type of stress in the body. That could be lifestyle or pathogens or anything that is going on and you're under stress, you automatically have that reflex of clenching and grinding your teeth. So we need to find, again, the source of the problem. Hopefully the source gets to get eliminated, but if not, at least until we get there, there has to be some means of protection so the teeth don't get damaged.
Right.
Now, the fourth factor, which unfortunately is out of anyone's control, would be any accidents. You know, if you somehow fall and you have a hit on your face, you break a tooth, that was something that was unavoidable. So then if you have a nerve damage or you break your tooth, you may end up needing a root canal at that point. So this is the only section that is like bad luck. You couldn't prevent it, it happened. But the first three categories is very much in your control, and you can control that, which is the major part of it actually, because accidents doesn't happen every day. But what we consume, how we take care of our oral health, this is something we can control on a daily basis.
Yeah. And what we consume in our diet, I want to definitely come back to that later on. And we talked a little bit about Weston Price in our last interview, but I think it's worth revisiting. But let's pivot, right? Because people are listening here and they're very interested about the connection with why root canals could be problematic. So tell us from your experience working with people, your review of the literature, and just paying attention to what's going on there, why is it that root canals can be problematic? And when do you look at it and say, this could be something that's contributing to one of the factors of chronic disease that this patient is going through?
Right. So in order to understand where the controversy comes from, or why as holistic dentists or alternative medicine doctors or biological dentists we are against root canals, or at least we see them as a risk factor, I need to go over very briefly about the tooth structure.
Yes.
Let's talk about the anatomy of the tooth, because it's all about that. So any teeth in our body, whether front or back teeth, is made out of different layers, okay? So the first layer of the tooth, which most people know by name, is called enamel, which is the hardest layer of the tooth, harder than bone. Second layer of the tooth, this is the tricky area, is called dentin. Now, dentin is composed of so many microtubules. So these are like straw-like structures, like tubes, but they're microscopic. So if I want to give you an analogy, if you put all these little tubules next to one another, like a straw, end to end to one another, your smallest tooth, which happens to be your lower front tooth, once you put all those little tubules next to one another, it will be 3 to 5 miles. That's how many little tiny tubules we have hidden in dentin. So inside that tubules, we have, it's fluid filled, it's not hollow. Then comes, so remember that second layer, because I'm going to come back to it. This is where the controversy comes, or this is where the danger of the root canal comes. It's all hidden in the second layer of the tooth, which now we know so much. Third layer of the tooth is pulp. That's where the canal, that basically the nerve and the blood vessels are located.
And that's PULP? Is that
PULP.
PULP.
Right. So when you do a root canal, or when a dentist does a root canal, in order to keep the tooth, they go through all these three layers to access the nerve, which is sitting inside the pulp, which is the third layer of the tooth, right? And then they will remove the major nerve and the blood vessels. When I say major nerve, just like the rest of our body, we have all these blood vessels and nerves that they're main nerves, and there we have so many accessory little tiny branches that comes off of it. Teeth are no difference. We have anywhere between 1 to 4 main nerves that we see with our naked eye. That's how big they are sitting inside the canal. But then we have tiny branches that comes off of those main nerves. Those are microscopic. No one can see them. They're hidden in lateral canals. They're in the dentinal tubules. So we don't have access to them. When we don't have access to something, we cannot clean them. So therefore, a root canal procedure, we only remove the major nerve that we can see. The rest of it is left untouched. So that means we are still letting go of some necrotic tissue, which leads to bacteria accumulation inside the tooth. That's why even endodontists who happen to be root canal specialists, they cannot argue with the fact that, are you guaranteeing that you removed all the necrotic tissue from the tooth? The answer is always no. No one can guarantee that, because there's not a single person in this world that has access to that. We only have access to the major nerve that we see. The rest of it we don't. So the problem comes when we leave this necrotic tissue inside the tooth and we seal it with some rubbery substance that we call gutta percha. Now, the bacteria, which oftentimes are anaerobic, which means they can survive without oxygen, have this beautiful space of dentinal tubules. Remember, 3 to 5 miles in smallest tooth. So imagine the posterior teeth that have 3 or 4 canals. much more dentinal tubules. So they have this space that they can reproduce, they can grow. And what does the anaerobic bacteria does? They produce toxins. Where does the toxin go? It doesn't just stay inside the tooth. Again, we have lateral canals that these toxins or bacteria, they can leak out literally outside the tooth. So what is outside the tooth that gets contaminated with these toxins and bacteria? One is our periodontal ligament, which basically no teeth is fused to the bone. Every tooth via ligament is attached to the bone. And these ligaments they have wonderful blood supplies, okay? And then after that, besides the ligament, there is a bone structure, alveolar bone, which is again filled with blood supplies. So now toxins have a way to escape into circulatory system and then become systemic, or bacteria can now become systemic. So this is the area that holistic dentists or biological dentists don't agree with, because anything necrotic that is causing or promoting anaerobic bacterial growth and toxins can cause health damage. And nowadays we know better. Like back in the days, you mentioned, or in the past, I talked about briefly about Dr. Weston Price, who happened to be a brilliant dentist. His only fault was he was 25 years ahead of his game. So people put on such a fight, and they still put on such a fight about his research. So what he did was 25 years of research. What he found out was, as a dentist, when he performs root canals on healthy individuals, when they come back later on in the game, they have all these systemic issues. Somehow it didn't make sense to him. So what he did, he started to linking it. Is this happening every time after I do a root canal? So he somehow was able to encourage the patients who had the root canals, let's remove the root canal tooth. You seem to have a heart condition, so let's remove this root canal tooth. And he did. So he started removing the root canal tooth from the patients who had general health issues, diabetic, arthritis, cascade of events. And he realized the health of the patients got much better. Then he took it a step further, and back then, I guess animal studies was very much allowed and okay. It was the norm. So he actually took the root canal tooth from the patient who had the heart disease. He extracted it and he placed it under the skin of the rabbit. And then, to his surprise, the rabbit that was healthy exactly created the same symptoms and the disease, ended up with a heart disease and died. And then he took the same tooth from that rabbit, put it under the skin of another rabbit, and he got the same results. He actually was able to produce the same results on 100 or 200 rabbits. Now, a patient who had arthritis, he would remove the tooth that had root canal and put it under the skin of the rabbit. The rabbit would get 85% of the time, if not more, the same exact condition.
Which sounds crazy.
Which is crazy.
But if you look at like the literature that's out there today, they're taking the poop, right? They're taking in the gut microbiome, right? He's dealing with the oral microbiome. But today, there have studies where they're taking the poop of individuals who are thin and injecting it into the rectum through a fecal transplant for another person that is, let's say, overweight. And they're seeing that the person who is overweight has now that their bacteria has changed, all of a sudden they're metabolizing food differently and they start to slim down a little bit, right? Or they're taking the fecal transplants in certain locations for kids on the autism spectrum. And again, these are small studies. We'll link to them so you can check them out. We need more of them. But there does seem to be evidence that when you take the gut microbiome through a fecal transplant and you take it from one person to another, you can replicate the same thing. It's just that he was doing it way before his time in the oral microbiome. Way before his
time. So, and unfortunately, some of the modern medicine that we have or technology we have available back nowadays, it wasn't available to him back then, which was a DNA analysis. So then he found out there has to be something in the root canal, whether it's a bacteria or a toxin that is causing this. This doesn't make sense. So what he did was, let me see if I can somehow outside in patient mouth perform root canal in a way that I can make the root canal 100% sterile. Because obviously any tooth that I'm removing that has root canal, when I culture it, has bacteria. So he used the strongest disinfectants, anything that is not allowed in patient's mouth. He pushed his boundaries, and he used that, soak it in for 2 days, and after that, sectioned the root canal tooth, cultured it, and to his surprise, he kept finding toxins and bacteria. So he was never able to 100% create a tooth with a root canal that is 100% sterile.
Sterile
outside,
environment.
Right, sterile environment.
And that's really the clincher is really what you're talking about when we say the concern around root canals. It's almost like mold in a way that I think about it, right? We have these buildings that we all live in, and we have little areas that, let's say, we board up, dry, completely like a attic crawl or whatever it might be, or a basement that we think is like completely clean. But bacteria will always find a way. Mold will always find a way, and it'll end up growing there. So we think this tooth is sealed. We think that it's completely sterile. We think it's not
causing us pain.
It's not causing us pain. We don't think that there's any repercussions, and yet bacteria will not only grow but can thrive in that environment because other non-anaerobic bacteria can't compete because it's only the anaerobic bacteria that is able to live in that area and then produce whatever form of toxicity that it produces.
Exactly. And even if you want to practice Western medicine or standard dentistry, if you give antibiotic to the patient, that's not going to help. Why? We cut the blood supplies to the tooth. We remove the vessels, the blood vessels. So the antibiotic, where does it go? It's systemic, it's in the blood, but it has no means or way of getting inside the tooth anymore, because remember, root canal, we remove the nerve and the blood vessels, so there is no more blood vessels, so we cannot even push this bacteria inside the tooth and the antibiotic inside the tooth anymore. So antibiotic is going to be totally out of use, or no use for it.
And to zoom out a little bit here, because this is where we want to be very careful and focus on education, there are no big studies, when I say big, I mean like big studies that are out there with thousands of people studying this area. First of all, it's to even get somebody to do a study on this, it's controversial, right?
Right.
It's difficult because there's so many factors that you have to look at, and it would take quite a bit of time. So we want to acknowledge that. But just because you don't have clinical trials at huge levels doesn't mean that there aren't doctors, dentists, boots on the ground that are seeing patterns and are having people pay attention, and that are raising, almost like Europe has the precautionary principle. It's saying, look, these chemicals in the environment, like glyphosate and GMOs, maybe we don't have big studies yet showing, big population studies showing that glyphosate causes cancer, right? Even though there is one now with lymphoma, but not with all the other cancers that are there. There's enough evidence and research that's out there that are showing we should have caution.
Absolutely.
So there's some documentaries that are out there, and there's some articles that float around the internet that make you think that, breast cancer and root canals are 100% linked. You get a root canal, you get breast cancer. And that's not what we're talking about.
That's not what we're talking. It's just bringing awareness that there could be some correlation.
Right. There could be some correlation. It's patient specific, and there is cause to be concerned about root canals in an ideal world through those main categories that you talked about, those three things. The fourth one we can't do much about, which is accidents. We try to set up our dental health and our oral microbiome and our nutrition so that we can avoid it.
Absolutely.
And then if we do have it, then, like for instance, we've had a root canal, we'll talk about that in a second. I know you have some recommendations. Then we can appropriately go get support for dealing with that at that time. So this is more of an awareness campaign and really taking the European approach of precautionary principle. Let's pay attention. There is some cause for concern. That's
right.
here.
Or this could be a possibility. So you'll be the judge, or have that in the back of your mind. If God forbid in the future something happened to you and you're just running around from one doctor to another, no one can find an answer, just remember, wait a second, 5 years ago, 10 years ago, I had that root canal done. Could this be the reason in my case?
Sure.
Just have that knowledge. At least you won't be a victim,
Totally. And I've talked about my mom on this podcast a few different times. And as I've mentioned, you are also her dentist. She drives up actually 2 hours to come and see you, which is really cute. She tells her friends, they're like, oh, you're going to LA, because she lives in San Diego now. Her and my father say, oh, you're going to go to LA. Like, what are you going to go for? Like, spend time with Kea and Dhru? And she's like, no, I'm just going up for my dentist appointment. And they're like, driving 2 hours for a dentist appointment? And she's like, yes, my dentist is the best. I love her. But anyways, I digress. My mom, as listeners know, was diagnosed with breast cancer, early stage, caught it early, had an incredible team. Now, my mom has had a couple root canals, I believe, right?
3 of them.
3 of them.
If I'm allowed to.
Yeah, you're allowed. She gave us
it.
permission, no HIPAA violation. She let us talk about all this stuff.
Yes.
And And most people that we talk about, because even back then, that was one of the things that came up with her functional medicine doctor, who's also been on this podcast before, Dr. Liz Bohm. She's a medical doctor and a nutritionist at our clinic, the Ultra Wellness Center. And she was one of the physicians on my mom's team, in addition to her oncologist and a researcher named Ralph Moss, who was previously at Sloan Kettering and writes a lot about cancer. They did ask her about root canals. They asked her about a lot of things. But also, my mom had insulin resistance. She had been a vegetarian her whole life and eating like a very high carb diet, not getting the right types of fats in her body. So we know that people who are insulin resistant, that makes them more likely to also develop, cancer. She had mercury fillings that are there. So that's another insult that's there. These are all factors and insults that add in, but just like we pay attention to the amount of sugar that we're eating, our levels of glucose, insulin resistance, just like we pay attention to heavy metals, or if somebody was exposed to some sort of environmental radiation, a root canal is another thing to throw in the mix to have an honest conversation about, because it can be one of the factors, one of the insults that can contribute to this environment where cancer is able to thrive.
100%. Yes.
So let's pivot from here, because now we've talked about what the problem is, right? The level of concern around root canals that are there.
And actually, let me add one thing to that.
Yes, please.
In today's world, again, since we have so much technology and more knowledge than in the past, we are able to sending a tooth or a culture for DNA analysis. And it comes back with a full report of what bacteria in that sample exist, what strain of bacteria, and then if certain strain of bacteria are linked to heart disease, we would know. So again, we have good bacteria, we have bad bacteria, and then the threshold matters. It just happens that every time, I just wished everyone had the funding to do so, including myself. But this is at the expense of either the dentist or the patients. Anytime you're removing the root canal tooth, whether it's symptomatic, whether it's not, it doesn't matter. Every time we send it to the lab, pathology lab, for that DNA analysis, when it comes back, there has not been a case that we didn't find pathogens or disease-causing bacteria at a high threshold.
Yeah. And
when they break it down, it's interesting. Some of them are the strains that are already connected to heart disease, heart attack. One is connected to the ones that cause neuromuscular issues. So it's really fascinating. It exists. But am I saying that everyone is going to become symptomatic? No. It really depends on the immune system once again. Someone is blessed to have a very strong immune system and can fight these toxins and these pathogens. Again, not to say that they don't exist. They're in their body, but they can fight it better, as opposed to someone else who's not, who's not blessed with the immune system, or perhaps down the line something happens to them and their immune system becomes compromised. Then they start showing signs and symptoms. So true, there are people walking around with root canal in their teeth that they have zero signs and symptoms and they're super healthy. And that's why this is the example. Many physicians or dentists in Western world that they try to use to back up root canal is like, I've had root canals for 20 years. Nothing has happened to me. I'm healthy. And they're right. They are healthy. But that doesn't mean the toxins are not there. And that doesn't mean another person is going to be just as lucky to remain healthy for the rest of their lives.
Talk to us about why mouthwash is really not a good solution, especially when it comes to protecting and avoiding decay inside the mouth.
Yeah. So as we said, we now know that there are protective probiotic species in the mouth, and for the most part, broad spectrum antibacterial mouthwashes decrease the diversity in the microbiome. And we know this is associated with the increase in disease. So once we remove the diversity of bacteria that live within the mouth and the gut, speak to the immune system and so forth, that's when we start to get the chronic disease in the mouth. But then also we know that in type 2 diabetes, obesity and so forth, we lose the diversity in the gut. And so mouthwash is one of the fastest ways to lose diversity in your microbiome. It's literally killing bacteria in the mouth, and daily antimicrobial mouthwashes are now being shown to start to increase the risk of people with pre-diabetes. So daily alcoholic mouthwashes can increase the risk of type 2 pre-diabetes. And we know that this loss of diversity in the gut corresponds to metabolic imbalances associated with type 2 diabetes. And so the same thing happens in the mouth. We have an increase in gum disease, for instance, with people with these metabolic issues. And so if you use antibacterial mouthwashes daily, you are decreasing the diversity of your microbiome. And that goes for toothpaste too. Any antimicrobial ingredient that you use in a toothpaste as well is decreasing the microbial populations in the mouth.
And we just had Dr. Lou Ignarro, Nobel Prize winner, on this podcast. Another thing he brought up is how much also mouthwash is impacting the bacteria that are essential for nitric oxide production at the beginning phase of nitric oxide production that starts in the mouth, and how that bacteria also keys into breathing through the nose. So there's a whole bunch of reasons why just like regular use of mouthwash is not a good idea. Stepping aside really quickly from the tooth decay conversation, do you have recommendations for the listeners who are like, okay, I'm still using mouthwash occasionally, you know, I have some bad breath, maybe I need to address my deeper gut health issues that are going on. But if somebody's looking for a better solution to replace the mouthwash, are there any more holistic interventions that you would recommend?
Yeah, so there are some mouthwashes. I don't recommend using antimicrobial treatments long term, but if you have an issue, say you have a lesion, or you have or you're using a mouthwash for some reason, then there are a number of products that are shown to increase or help the mineralization of teeth and cause less harm to the oral microbiome. And so, for instance, for paste, so hydroxyapatite pastes have been shown to remineralize teeth as effectively as fluoride. And the issue with fluoride is it interrupts with iodine metabolism in the body. So when you're using a hydroxyapatite paste, which is a mix of calcium and phosphate, which are the mineral balances we're talking about, you can put that topically into the mouth, and that has been shown to help to remineralize teeth. It can help with sensitivity too. I recommend it to patients that have sensitive teeth. They can put it on the surfaces of the root that are sometimes
and is that something that people, you know, where would they pick that up? Is this a specialty item? You know, I haven't come across it, so it might just be something that's easy to get, or you might have to ask for it somewhere. So how does one pick that ingredient up?
Yeah, there are a few around. So the one in Australia is tooth mousse, which is a hydroxyapatite paste. There's also there's a 3M paste with hydroxyapatite, and there's a few other brands that in America too. I'd have to.
Oh yeah. I'm looking here. There's a company that actually they DM'd me on Instagram a few days ago called Risewell. Risewell. They have a natural hydroxyapatite toothpaste.
Yeah, so that's so that's using that active ingredient. I've seen Risewell, yeah.
But it may not be what you are encouraging. You just want the raw paste itself without the toothpaste. Is that what you're saying?
Yeah, exactly. So anything with hydroxyapatite in it is replacing those minerals. It's a different philosophy to what we've used in conventional antibacterial treatments. And so for mouthwash, an interesting one that it's funny we've lost the use of iodine in the mouth, because iodine was long used for even tooth decay, so topical iodine for the treatment of topical lesions. But you can have molecular iodine mouthwashes as a safe and effective antimicrobial. Again, I don't recommend it using long term, but an interesting connection there is that, you know, often with tooth issues, and we see, you know, in kids with lesions, so forth, there's concurrent thyroid issues, and thyroid issues can be associated with iodine deficiency. So it's maybe speaking to this issue, you know, where we're seeing the manifestations of tooth decay associated with thyroid issues. And molecular iodine in mouthwashes, although people with hypothyroidism need to be careful with iodine, for instance, it may be a good topical way to if you have a lesion or oral disease. Another one is chlorine dioxide mouthwash, which is a much lower harsh the way its antimicrobial methods, and so you can get a few of the chlorine dioxide, and it has been shown to reduce certain species of disease-causing bacteria in the mouth as well.
Yeah, and I mean, everybody has a little bit of morning breath when you first wake up or that sort of thing, just from the stagnation. Actually, it's often increased by mouth breathing, which we can talk about here in a second. But perpetual bad breath and deep bad breath, especially later on in the day where people are covering it up with breath mints or mouthwash, it's really a sign of a chronic issue that you got to get checked out. Either is there stuff going on in your dental health, like some gum disease? Have you not been to the dentist in a little while? Or is something going on with your with your gut microbiome that really needs rebalancing, and you have to follow and maybe work with the functional medicine doctor to get that, sorted out. So let's talk about, so that was, we were just taking a little bit of break for talking about some of those alternatives to mouthwash. Bring in the mouth breathing piece and the summary of how mouth breathing is connected to tooth decay.
So all of the factors we've been talking about, the minerals, the immune factors, the nutrients that support the healthy maintenance of tooth enamel, are connected to this saliva in the mouth, and the way that saliva works is via contact on the teeth. Now, if you dry the teeth out, then you're going to increase the risk of tooth decay. And what we often see, for instance, in patients that have head and neck cancers, and they've had radiotherapy on these areas, and they lose the efficacy of the saliva gland on one side, you'll often see a decay pattern shot across that side of the mouth where the lack of saliva is. So without that nourishment from saliva, which is full of minerals and these factors we're talking about, you don't have the protective balances of the body. And so the fastest way you can take away saliva from the mouth, and for instance, if you have morning breath, it's probably a sign that you're doing some amount of mouth breathing through the night. So if you breathe through the mouth, then you're drying out the saliva. And so as an aside, we're not supposed to, your mouth's for eating, your nose is for breathing. This has become quite a big topic of late. The dentist talking about mouth taping. Mark Boheny has been a big advocate of that for years. And there's a recent book by James Nestor on how we can reverse sleep apnea just by taping the mouth at night. There's a lot to that, but for tooth decay, so in children that have lesions across the front of the mouth, or bottle or nursing caries, for instance. So a lot of mothers are seeing kids with lesions across the front of the teeth, and they're nursing, and they're saying, well, why is this happening? Well, if any type of liquid with some amount of simple carbohydrate in it left on the surface of the teeth to dry out will eventually cause decay. And so in kids that mouth breathe, in adults that mouth breathe, when you have this dryness of and it can be associated with open mouth posture, can be associated with lip ties, so the flap of skin up under the upper lip, which causes the lip to lift up, and we don't see the seal of the mouth. That happens in kids a lot, and if there's difficulty breastfeeding, but it can be a reason why a child gets tooth decay if they're constantly drying out that saliva.
Yeah, it's really incredible. I mean, it's like next level dentistry that is being there. And there's dentists like yourself that are really sounding the alarm. And even actually, when you first had told me about it a few years ago, I was like, I had never known it was that much of an issue. I knew of sleep apnea. I knew of like snoring. I knew of things like that, but I did not know the full circle at all. And you really were the one to introduce me to that. So just to make sure everybody understands that's listening, these are primarily, it can be during the day. I mean, there are people that breathe through the mouth during the day, but for a lot of individuals who don't notice it, we're really talking about when individuals go to sleep at night, and they, for a few reasons, could be jaw structure. It could be related to a tongue tie, which is the bottom of your tongue is set up in a way where your tongue is not able to collapse correctly the roof of the mouth and create the circulation of oxygen through your nose. And there might be a couple other reasons, but basically you end up breathing through your mouth because your body cannot properly get the oxygen through the nose. And that's what you're talking about with mouth breathing. It's primarily something that's showing up at night when people are sleeping.
That's right. And especially, for people that have had a few lesions in the mouth, so cavities, you want to be thinking about how you're breathing and how that saliva. So there's a lot of, patients I see that, we talk about all this and they're like, yep, I'm onto this. They change their diet, they take supplements and so forth. They go and see a functional medicine doctor. But if they're not breathing, through the nose, through the night, especially when we're unconscious, then you're not giving the body the ability to use all these factors to remineralize the teeth. And remineralization, as we talked about, it's a long process, so you have to let it happen. And I think one of the more powerful ways you can do it is to get deep sleep by breathing through the nose. The nervous system calms down. One thing you need to remember too is that teeth are connected to the trigeminal nerve, the biggest cranial nerve in the body. Most innervated through the head. It's connected to all the upper teeth, connects in like a web up and runs in the jaw here. The brain is very, very closely listening to what's happening in the mouth. And they've even shown that, for instance, that certain bacteria can get into the brain. And in Alzheimer's disease, you find an oral bacteria that shows up in gum disease, and it's in the brain of rats, and also they're starting to show it in humans as well. But we know that bacteria crawl up and down the nerves. So breathing is a way to calm the nervous system down, and then all the factors that you can put into your body. It really needs you to get deep sleep, to breathe correctly, use the respiratory system correctly, and let the saliva bathe the teeth, let the endocrine system calm down, let the thyroid calm down, so that all these things can balance, and the body can start to put these minerals back where they should be.
And mouth taping is like a whole discussion on its own, and addressing sort of it's a short-term intervention that people can do right away. And it literally is that you can either use, some people are using duct tape, which is easier if you don't have a beard, but there's also custom made. There's a company called Somnifix. They make a mouth tape, and you can Google it on, Amazon. Non-toxic mouth tape that is very easy, and it doesn't make you feel like the first time that I was using it with my fiance, because I would notice that she wasn't getting the best and deepest sleep that was there. And I noticed a few times when I woke up in the middle of the night that she was breathing through her mouth. So I said, let's try this mouth tape as one of the mechanisms to help you sleep and get better rest. That's the other plus side, is not only does it protect your teeth, but it's also helping with that aspect of deeper rest, because a whole new layer of oxygenation happens for the body. So you put on this like Somnifix, tape, and she was so worried she was going to feel like claustrophobic, like somebody's like smothering her at night. And actually, sometimes I say it's maybe not even strong enough, because it's very easy to kind of take off sometimes. But once you get used to it, you just wear it, and you wear it the whole night, and you wake up the next day and your mouth isn't dry, and you aren't grinding your teeth. For a lot of people who are grinding their teeth, that's another thing that you've talked about, is that it could be because they're breathing through their mouth and their body is stressed. And then there's that grinding action that ends up happening. But we'll link to a few resources that you have on the topic. And especially on the longer term thing, when it comes to kids, they might need sometimes minimally invasive surgeries or other things to correct jaw structure. And I know you talk a lot about that. So we'll link to that in the show notes. Is there any blog posts or something like that you want us to link to, or that our audience can get more education on this topic for mouth breathing and correcting that process?
Yeah, if you go to my website and search mouth breathing and myofunctional orthodontics, so that's the type of orthodontics that looks to grow the jaw. It's quite a delicate conversation with partners, to tell them to take their mouth right to sleep, and it's the same dynamic kind of with patients too. When I say, look, you can maybe try taping your mouth. There's often a very kind of awkward reaction, and when people kind of don't know the reason behind it, it's a bit delicate. But
it sounds crazy. Let's be honest. It sounds like you are crazy, and you're like, "What the f are you talking about? Taping my mouth? Like, what the hell?" But there's a lot of, there's a lot of understanding, science, and research that's there. Sorry to interrupt.
No, yeah, totally. But that's, and so with my experience with mouth taping, and this is what I see a lot in patients, people that are habitual mouth breathing. I was mouth breathing at night. And so it took me a long time to be able to tolerate tape on the mouth. I would subconsciously take it off because my body, my brainstem was not was not tied into being able to breathe deeply and let the oxygen transfer happen. And the reason is because you don't get enough tolerance to carbon dioxide. So when you breathe deeply through the nose, carbon dioxide rises, and then you get the exchange of gases at the alveoli of the lungs and into the bloodstream. When you breathe through the mouth very shallowly, that exchange doesn't happen. You have to train your body into doing this. Otherwise, it feels like you're suffocating, which is what your partner, her reaction had, is this feeling of suffocation. I had the same thing with the idea of taping the mouth. So things like breath work and exercises and potato breathing, for instance, and myofunctional orthodontics looks to address this. Same with tongue posture as well. So tongue posture helps, like we talked about, support the oropharyngeal area, and all of these things connecting together. Unfortunately, with dental issues, it doesn't happen overnight, but that's, kind of like anything with health, we kind of just have to commit to the, understanding where the problem came from. And then, if we know the importance of it, I think, a lot of people can kind of get into that mindset to changing their life and the benefits that will eventually come. It doesn't happen overnight. Yeah, it took me like 3 months to be able to tolerate mouth tape, but now if I sleep without it, I very much notice the difference.
So we talked about mouth taping with tooth decay and its other benefits. We've talked about avoiding like alcohol-based mouthwashes or antimicrobial-based mouthwashes to protect the oral microbiome. And then going back to our earlier thing, you talked about the benefits of certain types of fat-soluble vitamins and right nutrients, potentially including organ meats in your original article, you provided a lot of different suggestions and even kind of like a protocol that people could follow. Again, this doesn't happen overnight, but if somebody today was noticing that they went to the dentist office and they were noticing that they're starting to get a little decay, maybe not like a full blown decay, I don't know the proper terminology in dentistry, but there's a little bit of decay that's starting to build up on a tooth that's there. Would you still recommend following your protocol? If so, can you walk us through that? And it's so personalized, but as a whole, do you think this is something that could still potentially help them reverse this decay?
Yeah. So when you go to the dentist and you have an oral examination where they take x-rays and they'll do an intraoral exam, if they identify a lesion, what you'll be able to identify is the depth of the lesion. And so that's how that we generally class the severity of decay. So what happens is you get a shadowing on the x-ray. And so if that shadowing stays in the enamel, that's generally called a class 1 to class 2 lesion. These lesions can be remineralized. So that means it's not broken. You may not even notice it's there, but the dentist will pick it up. Now, in these cases, we know these and so what the conventional dental treatment of that would be to put topical fluoride on that. And the issue with fluoride is that it will harden the enamel, but it won't necessarily change the underlying issue that causes decay. So if you have a lesion in enamel, you can very much be of the mindset that this can be remineralized or reversed. If it's into the dentine, now you're getting to the zone where the decay is getting closer to the nerve, and there becomes risk that if you just leave it, you can get an infection of the nerve. And so you really kind of have to work with your dentist in that sense and understand the risks and so forth, and make those decisions. But if you have an enamel or an early dentine lesion, there may be a zone where you can enact some lifestyle change to see. And what you can do is you can go back in 3 to 6 months, take new x-rays and check if the lesion is remineralized, because you'll see this on the x-rays. They'll actually increase their radio opacity or their whiteness on the x-ray, and if it's remineralized, and you can put them side by side. So you want to work with the dentist with this, because without that, you don't have any feedback, and you just don't know what's happening. But so all the factors that we're starting to talk about. So if you have this lesion, you need to be thinking deficiency. I think across the board, my patients that have tooth decay, I recommend they go and get a vitamin D deficiency test. And so this checks your blood levels of vitamin D. Now, the issue is that there's a lot of detail with blood levels of vitamin D. You can have sufficient levels and sometimes that doesn't work, or some people have low levels and it takes a long time for them to lift up. Supplementation, we remember that supplementation needs to be activated into its active form in the body. So the version of vitamin D you take via supplement form has to be activated again, and then that's the version that activates all the gene receptors throughout the body for vitamin D. So supplements are it's one aspect to this, but knowing your vitamin D levels when we have a lesion is very important, and then we can supplement alongside. But then dietary, we need to replace these foods, and so foods like rich in fat-soluble vitamins such as cod liver oil. If you can take a desiccated liver capsule, for people that aren't going to go out there and cook liver themselves, you can take a desiccated liver capsule, and you take 4 to 6 of them a day with cod liver oil, and then you can test your vitamin D levels to see if they're lifting up after 3 to 6 months. And then within that, if you're getting X-rays on the lesion, we can start to see if we're seeing some changes in the enamel. Other factors to think about: vitamin K2, which comes in same as organ meats. If you eat these foods, you're going to get a broad spectrum of these nutrients. You can also supplement K2. It comes in 2 forms: the menaquinone 4, which is the animal sourced one, and the menaquinone 7. The menaquinone 4, which is the animal source, is more active in the body, and the menaquinone 7 comes from fermented foods like sauerkraut and other vegetable ferments and so forth, some dairy too. So you can supplement both of those forms too. If you take a D3 supplement, you should always take a K2 supplement. And one of the things that people, not many people are talking about now is vitamin A. So you get vitamin A with cod liver oil, but vitamin D deficiency also, vitamin A and vitamin D work together. And so if you have an increase in vitamin D, it increases the need for vitamin A in the body. So if you take a vitamin D supplement, we should really be thinking vitamin A as well. And you can get these from natural food sources like organ meats, but you can also supplement as well. And so these things work together. And then the thing that catalyzes all these nutrients are magnesium. Magnesium is a mineral that we don't talk about. It's actually within the tooth structure as well. So you need to be getting a lot of magnesium for all of these nutrients to work. And if you take enough vitamin D, but you're magnesium deficient, it won't work. And so magnesium itself is a mineral that sits along the outside of the structure of the calcium phosphate tooth mineral. And if you're magnesium deficient, your vitamin D receptors won't work. The kidneys will actually remove more minerals from your body because we're deficient in these in calcium and phosphate and magnesium. And so you have to get a lot of magnesium. So I think today, because of the way food quality is stripped out, we don't get enough magnesium than what we used to. So soils quality has gone down. So people supplementing vitamin D, K2A, and magnesium makes a lot of sense in terms of making sure that you're getting enough of these nutrients. And then making sure you test. You can test your D levels. Check your symptoms with magnesium. Sometimes you can get digestive symptoms like you can get where your stools become quite loose and so forth. You can titrate that depending on your symptoms. And then things like ferments, so like oral probiotics, so things like kefir, things like fermented vegetables. These things replenish the oral bacteria, and we want to be replenishing the oral environment in order for it to be able to regenerate. And the other thing that we talked about before is that bone, before bone is made, it's a collagen matrix. So the body lays down amino acids, and then it calcifies those amino acids. So for tooth structure to remineralize, you need collagen amino acids, and these come in foods like bone broth from the joints of animals, from the skin, from you can take a collagen supplement, but I think it's really important if you're trying to remineralize some some cavities in your mouth, you need that precursor for bone. Otherwise, your body's going to be trying to pull these amino acids where you're in deficiency. So when you put these things together and you take regular interval x-rays, you can potentially manage lesion. You may see certain lesions remineralize. You can take photos of them. A dentist will often get intraoral photographs of them. And so it's possible. It does happen, but you have to be very careful. You have to understand all the different risks and know that if a lesion goes too far, you can get quite a bad toothache that can end up in an infection.
Yeah. And like you said, as you've shared before, it's really a partnership. Find a good biological or functional dentist that understands your goals. There's a great database that in the US where a lot of our listeners are. Dr. Mark Berhana has one. You're out in Australia. You have a clinic out there. People can come check you out. And I'm sure you have referrals for other people that are in that region. But I think the larger message from what I'm hearing from you is that, your oral health is your whole body health. So anything that's going on in your mouth is probably an indication of something that's going on in the body. As people have seen this year, especially, a whole bunch of people who thought vitamin D was just a vitamin now know through, all the studies that we're seeing out of the US and China and Italy on coronavirus is that a huge percentage of individuals who passed away from COVID-19 were vitamin D deficient, and a huge percentage of people who get vitamin D are get coronavirus or vitamin D deficient. Even to the extent that here in Los Angeles and a few other cities, there are a group of people that are looking at the homeless population, the people that don't have anywhere to live, and they have been scratching their heads wondering, how is it that this population, we've not seen major outbreaks of coronavirus, right? Like, what is it that's going on with them that they are not seeing major outbreaks of coronavirus? And one of the theories that's there was a really great episode done by a podcast that I'm a huge fan of called Radiolab, called Invisible Allies. We'll link to it in the show notes. One of the things that they're theorizing is that, yes, there's a lot of things that homeless people can be subjected to, teeth infections, other stuff, not having access to dental care, their diet isn't all the best, parasitic stuff. But it does seem to be that certain diseases that affect everybody else are not affecting them because their vitamin D levels are so high because they're out in the sun. I mean, pretty much during the day. So it's a theory, it's not fully established, but it's one of the theories as to why we haven't seen deep COVID outbreaks in the homeless population, especially here in Los Angeles. And that if we're going to fix these things and when we address them in our dental health, it's not just for our dental health. These things are going to benefit all aspects of our life. Our dental health is our full body health. Our full body health is our dental health. That's what I'm hearing is your message.
Yeah, absolutely. And vitamin D deficiency, I came in with the, following Weston A. Price's idea that deficiency causes all dental disease we see in modern society, but it just goes right throughout every disease we see. You mentioned Terry Walls. Autoimmune issues are, shown in the literature to be underlying in geographical shifts away from the equator, and we know that vitamin D deficiency affects these conditions. It affects digestive issues. It affects metabolic issues. The brain, Alzheimer's disease now is shown to be heavily related to vitamin D as well. I came in looking at how teeth are affected by vitamin D, which makes a lot of sense considering the skeletal system, but it does so much more. And all of these things are pointing to and you mentioned connection to the sun. That's something I didn't get to mention, but that's something I'm telling patients more and more is we have to get exposure to the sun. And there are circadian rhythms in the body that regulate all of the things we talk about today. And unless you're getting exposure to when sunrise, so when the morning sun rises, the neurotransmitters in your brain shift from melatonin to serotonin, and that's your daytime, up and functioning upper endocrine management system, but then dark as well. So if you have artificial lights in your in your house, it can affect your endocrine system. And these things are affecting everything from your brain to your skeletal system, right through to risks of conditions like autoimmune conditions as well. When
somebody has had a root canal, right? And they're fortunate enough to seek out a functional dentist, biological dentist like yourself. What's the next step from there, especially if they think that they might be going through some things, or even if they're not going through any kind of health issues, but they want to address it now so that it doesn't become a bigger problem later on?
Great. So one of the first things I do, remember, as we said, patient may be completely asymptomatic. They may not have pain. So, or they've gone through routine dental exam and x-rays and nothing shows in the two-dimensional x-rays. One of the first thing I do if I see a patient with a root canal, whether they complain about it or not, for their education and my findings, I encourage them to get the proper x-ray, which is a cone beam or a CT scan. This gives me an ability to take a look at the tooth three-dimensionally, so there is no information getting lost. So if there is something that the images are not superimposed, like a two-dimensional x-ray, so therefore we get to see much better in details and contrast of what's happening three-dimensionally. When the results come back, it's to my surprise, a lot of time, again, the root canal that looks really good in a regular x-ray, when the CT scan comes up, we see lesions that didn't exist in the other one. So when you see lesions, when you see shadows or we see potential infection, that's when you go back to patient and say, listen, based on a CT scan, the root canal is already failing. You're not symptomatic, but look, it's there. Or
because the lesion is an example of the bacteria doing damage.
Exactly. To the
right? Toxicity there.
Exactly.
And now it's like, okay, there's some cause for concern.
Exactly.
And if you just rely, or if your dentist just relied on a traditional x-ray, they may not see that.
Exactly. They can very well miss it. And it happens all the time. In fact, it has happened that patients didn't have CT scans or cone beam x-rays, but they decided to remove the root canals because of all the information's out there. And when I extracted the tooth, because I didn't have to enroll the patient, this root canals is bad, through the CT scan. But when I extracted the tooth, amazingly, there was an abscess. Now, that abscess did not show in my x-ray or anyone else's x-ray because it was a two-dimensional x-ray, and we didn't have a CT scan, but oftentimes we find pathology when we are extracting the teeth, something that we were completely blindfolded with regular x-ray or two-dimensional x-ray.
So let's say you get back the CT scan, and actually you're dealing with this right now with my mom, for example, and you do see lesions that are there. What's the next step or considerations?
So the next step is to break down, unfortunately, the bad news. The only way you can get rid of this lesion is to get rid of the source. The root canal is failing, the toxins are there, is already damaging the surrounding tooth structure, which is the bone and the ligaments. So therefore, the best way to get rid of it would be to get rid of the source. And unfortunately, that means getting rid of the tooth. But in today's world, there are so many different ways of replacing that tooth. So I always tell my patients, especially again, I become more case specific. So I tell the patient, listen, your root canal is failing. Here is a proof. It shows in the CT scan. Now, based on your health especially, you've had some issues in the past, which could be related to the bad root canal, could not, but your immune system is not the strongest because you had some degenerative diseases in the past. So do you want to take a chance of holding on to a root canal that already shows that it's failing, or you prefer to put your health first? We can all live without one tooth or two teeth, but the overall health it means a lot more. So I rather err towards safety, meaning encourage the patient honestly. Once especially when I see a lesion on CT scan, that's no brainer. We know it's there. We know the damage is happening. I can't fool myself. It's already failing. So I encourage the patient to remove it. By remove it, I mean removing it holistically. And there's a difference also in this branch of medicine versus regular dentistry of taking out teeth non-holistically.
Talk about that for a second, since we're on the topic.
In dentistry, usually standard is when you remove the tooth, you just remove the tooth and that's it, you're done. The very best, you irrigate and that's it, or disinfect the area. Remember what I said earlier, the bacteria or the toxins, they leak out of the tooth. Where do they go? They spread to the surrounding tooth structure or periodontal ligament. So if you remove the tooth and you don't debride or clean that area thoroughly, you're trapping still some toxins and bacteria, and the bone tries to heal. Those areas that still have those anaerobic bacteria will not heal perfectly. So you're entrapping those bacteria inside the bone. You literally will have cavitation or little holes or defects inside the bone.
It's
and
almost like
bacteria.
a rotting, it's like
Exactly.
rotting organisms inside an enclosed area.
Right, and they can always grow because they have all the nutrients and blood supply. So very important when you're removing the tooth to do it holistically. What does that mean? This is the steps. The surgeon or a dentist needs to remove all the ligaments that are infected as a result of the bacteria or toxins. And also, if there is any bony defects, that needs to be scraped off and also removed.
So this would be typically called like a cavitation surgery.
If they don't do it, unfortunately, some people end up with a cavitation, which means defects inside the bone, leaving the bacteria inside the bone, which now they have to go back, do a second surgery after the healing, go back in there and clean out the cavitation.
That happens when it's not done correctly the first time,
exactly.
which is why it's so important to work with somebody who understands that, seeking out a holistic, biological,
100%.
functional dentist who knows that can be an issue.
Right, exactly, because they're conscious of it, they're a believer of it, so therefore they look for these things and do it at the time rather than when the patient becomes symptomatic later on, introducing another procedure or another surgery. And also, during that time of surgery, is important if someone has access to ozone dentistry or ozone medicine. So we use ozonated water, which has a great healing ability, ozone injection, ozone gas, to debride the area before we seal, before we suture. Or we do what we call PRF, which is platelet-rich fibrin, which basically is used in so many different areas of the medicine and dentistry, which means drawing someone's blood, your own blood, putting it in centrifuge, and when the centrifuge basically spins, it separates the different levels of blood, and we use the gold portion, which basically is filled with your growth factor, your antibodies, and just a little bit of your stem cell. We're not going to call it stem cell therapy because there's very little tiny amount of stem cell in there, but majority of the portion that we are using or we are after is your own antibodies and your own growth factor. So what does these antibodies do? Helps you fight the infection. So oftentimes I'm not black and white about antibiotics, but I'm not very prone of antibiotics. So when I do an extractions, I don't place my patients on antibiotics unless once in a while I see a very bad infection that I think the patient, depending on their immune system, may need a little help with antibiotics.
Right, the mindful use of antibiotics.
Right, exactly.
If we can use your body's own ability or something like ozone, which is being used in a lot of different things,
and your own antibodies and PRF, that helps you fight infections.
Right.
So these are the things that helps for you to heal properly and avoid cavitation, which is potentially another future surgery for the patient if it's not done holistically.
I want to interject with one other sort of anecdote. You know, my business partner, who also comes to you when he flies into LA, Dr. Mark Hyman, he's been very vocal about the fact that about 2.5 years ago, 3 years ago, he had a major gut health issue. And originally they thought that he got C. diff at the clinic that is the partnership with the Cleveland Clinic, the Center for Functional Medicine. He thought he had C. difficile at the hospital, but later found out that a lot of his gut issues came from a root canal that went wrong. Right. A root canal that went wrong, and then he took antibiotics for it, and a whole series of cascading effects ended up happening where he basically destroyed, his gut got completely destroyed. And this is Dr. Hyman, who eats healthy, lives healthy, works out, does all this stuff.
Everybody uses him as an example. Exactly.
Everybody uses him as an example. He's 6 years old, looks fantastic. But this is a perfect example of how even people who are very healthy, in a single situation of not handling something like that correctly, it can lead to a lot of cascading downward, impact on your health.
100%. Yes.
So in this issue where, you're delivering the patient the bad news, good news, right?
Right.
Bad news is that unfortunately you have to take out this tooth that's there. Good news is that, hey, listen, we can do something about it. It's good that we found this. You don't want to be sitting with lesions for the rest of your life, right? Because that can lead to a lot of different things that are there. When it's actually time to do the extraction, it's about finding the right person, holistic dentistry.
To do it correctly.
To do it correctly. And then is the final aspect, after all it's been done correctly, sterilized correctly, used holistically, minimizing antibiotics, is then the next thing is then the patient is finding in a replacement tooth that's there.
Right. What are the means of replacing? So obviously, patient has a choice of getting removable prostheses. That's an option. It's not the most ideal in today's world, something that like a denture or partial denture that you put it in and you remove it, false tooth. Patient has an option of bridge. Again, not my top choice, basically only because when you do a bridge, you're trying to, if there's a missing tooth in the middle and you have a tooth in the back and you have a tooth in the front, you shave the front tooth, you shave the back tooth, and you place 2 crowns, and then the middle tooth that is missing, there's a fake crown that is connected. In other words, there are 3 crowns connected as one, bridge them together, and it gets cemented on. So it is fixed, it's not removable, but the downside to that, you're actually shaving or altering the tooth structure that is not necessary to do so. So as much as possible, I prefer the ideal treatment if the patient doesn't have major systemic issues, meaning they're not going through radiations, they don't have uncontrolled diabetes, they're not chronic smokers. Implant would be a much better option to go. There is a very high percentage of success, over 95%, and there are different materials nowadays available. For someone who wants to stay completely metal-free, there is a porcelain zirconia implant available nowadays that is being used, which has 0 metal. And then if not, then 100% fully titanium metal would be the next things to do. So those are the 3 options available to replace the tooth. And really depends on each person,
right,
which option they want to opt for.
A lot of options that are there, but biggest thing is trying to address and get to the root issue and figure out if this thing is an issue. And maybe it's not for you at the moment and you don't see lesions, and then you could say, okay, I'm choosing not to address it or fix it right now.
That is great, which I even face that sometimes in my practice. You bring the awareness, and that's the whole point.
Right.
You educate them so they have that conversation in the back of their mind. Sometimes a healthy individual says, you know what, doc, thank God I'm healthy, I hear you, but I'm not ready to remove this tooth. Then the very least what they can do, first of all, watch out for their health. So if anything significant happen down the line, know that there could be a correlation. 2, every 5 years, they should repeat the CT scan.
Right. Be just the same way that somebody might get a colonoscopy, right, to just make sure that they're not headed in that direction, because again, right, you don't necessarily know that there's a problem when the problem first starts.
Exactly. So at least choose either 2. Either monitor yourself, but get screened every 5 years with that CT scan so we can monitor the changes, or some people jump in and do that. They don't want to take a chance. They don't want to put their health at risk, and they go for the extractions and they heal and they replace the tooth. It's not the end of the world.
It's not the end of the world. And, there's always this, there's like a meme on social media. I think it was on Instagram, but probably on Facebook too. People always compare going to the dentist with like they'd always say like, I'd rather go to the dentist, right? Like when they're talking about like a difficult thing in their life.
It's like the worst thing in the world.
Right? It's like the worst thing in the world. They don't want to deal with this. I'd rather go to the dentist and have my teeth drilled in. True. And it's really along the lines of, dental health issues and having so much work done on our teeth, including cavities and other stuff. In terms of humanity and Homo sapiens, it's a very new thing, right? Sure. It's following along with our industrialized junk food sort of world, our nutrient deficient world, lacking in vitamin D, lacking in K2, lacking in these essential things. I mean, people don't understand that for the longest time, and this is the work of Weston Price, people had healthy teeth. If you go look at the teeth of modern day hunter-gatherer societies, I went and visited one. I went to Kenya a few years ago. I'm born in Kenya, in Nairobi, and a group asked me, a buddy of mine, Elliot, said, we're going to go to Kenya and we're going to go hang out with this tribe, modern day hunter-gatherers, and they're called the Samburu. They are cousins of the Maasai. People know the Maasai tribe in Kenya. And they have entered into this private-public partnership with the government where they're protecting these endangered elephants in this region. It's over 1 million square miles. And I was so excited, besides my just general fascination with elephants and travel. And when I got there, I was reminded of Weston Price's work, because every single person that I met, and these are people that their diet basically consists of this particular tribe. They don't really eat a lot. They just drink milk from the cow and occasionally some goat's milk that's there. And they've been having this diet as long as their evolution has been around there. Their teeth are perfect. They don't have a dentist. right? They chew they don't brush their teeth.
Right.
They don't brush. Their dental health is great. Even the older people, unless if there was an accident, which there are, right? There are accidents. Unless you bit on something and it broke a tooth, that's the unfortunate side of it. They don't have access to dentistry that's there. So even a small problem becomes very big because they don't have great dentists like yourself to help them address it early on. But their teeth are amazing.
True.
And they don't have access to all the stuff that we have access to. It's just another reminder that if we can take care of our teeth, if we can be proactive about it, going to the dentist doesn't have to be this really scary thing or this thing that we avoid or dread dealing with. It can be just a little side thing that we don't have to pay attention too much to in our life versus you see so many older people today, both my grandparents, right, on my mom's side, had such bad dental health. My grandfather, and it really interfered with their life, especially as they got older and were dealing with different chronic diseases that are there. So all in all, I guess I'm basically saying is that we don't have to dread the dentist. We can be proactive about our dental health. Sure. And actually think of it as our overall body health too. It's just not just our teeth are separate from the body.
Dental health matters.
It really does. Dental health does matter. What else do you want to say to the people that are listening?
I thought it would be fun to talk about some cases that I personally got to witness.
Please, yes, let's do it. People love case studies.
And this is something that we get to see miracles unfolding literally every day in front of us, and hence why we are so adamant about practicing the way we do. So I had some interesting cases coming my way, and one of the case was this lady. She was about 75 years old, Asian lady, who had had a series of root canal done. Some of them repeated twice because it had failed. And it's interesting, she came up with that correlation herself, not any other doctors that she had gone. And she noticed that after a while, she started having some hearing loss. And also, suddenly in one day, there was a ringing in the ear that happened and never stopped for 2 years.
Like a version of tinnitus.
Exactly. So there's this buzzing sound which is irritating her, and she's going from one ENT, one doctor to another, and no one can find out what's going on. And then towards the end, she got the sense that people are not trusting what she's saying, and they're not believing because every test they did, they couldn't find out what's wrong. So she was complaining of ringing in the ear constantly, wouldn't go away, driving her nuts for 2 consecutive years. So finally she gives up and she goes to, and oftentimes it's a common story when people become more or less, for the lack of words, desperate, they go to holistic doctors or
I've tried everything else.
I've tried everything else and nothing is working. So tell me if I have to stand on my head to make this work, I will do it.
Right.
So she goes to an alternative medicine doctor, which thankfully she did the examination. She contacted me because, again, one of the things that I take pride, I'm very much in communication with all the doctors that we work. We are a very strong team, a very close team. So she called and said, Dr. Rashtian, this is puzzling me. This is what's going on with her case. Do you know anything about it? Can this be anything orally that you can help me? And I'm like, you know what? I don't know. It could be ringing in the ear. Could be could be heavy metals. Could be root canals. So, have her over. Let me do an examination. So I did an examination, and unfortunately, I found 6 root canals.
Wow.
And one of them especially looked really bad in just the 2-dimensional X-ray. That's when I had not even taken the CT scan or cone beam. So I look at her, and this lady looking at me desperately, can you help me? And of course, I want to say, I've known of correlation, but you can never guarantee, especially someone who's been throughout the 2 years have been seeking help from one doctor to another, and she has invested so much. She told me, you know how much these root canals have costed me? I did some of them twice, and so I've already invested this much, and I'm blown away. Here I am trying to tell the patient, well, the only thing I can suggest is after all this investment, let's remove them. But so I told her what the correlation is, but at the same time, I told her, listen, it's not guaranteed.
No promises.
There's no promises. I have seen this happening in the past. I've seen, I've read enough data or research that there has been a correlation. In your case, I can't guarantee it. And then the minute I haven't even finished my sentence, she goes, remove the tooth. And I'm like, are you sure you want to do it? He goes, yes. No, at least you trust me. At least you know that I'm not making this up. So I'm okay. Remove this tooth. This is driving me crazy.
Right, and she's probably in that situation weighing the pros and cons, removing the tooth. There's some personal feelings around, well, I don't want to have a tooth removed and have it in, but what's the worst thing that can happen, and especially after all this suffering that she's gone through.
So I tell her, listen, this is a big decision, especially since you have 6 teeth. Therefore, why don't you go sleep on it, think about it, come back tomorrow. If you are agreeing to removing the tooth, I like to remove the tooth that really looks the worst to me. The root canal that actually looks the worst to me. And she agreed. She comes back the next day, I remove the tooth. She goes home. So I call to follow up and see how she's doing the following day. And then when I pick up the phone, I say, this Dr. Rashtian, how you doing? She starts crying. And here I am. I'm like, oh my gosh. She's sorry she did it.
Oh my gosh.
I'm like, she's already sorry she did it. It's already one day. She's crying over the phone. I'm like, what's going on? She's like, you won't believe this. I'm like, what? She's like, I've been wanting to call you, but I wanted to give it more time. I'm like, what? She goes, literally, as I was driving home, after 30 minutes of the extraction, the buzzing stopped. There is no ringing in my ear. This is after 2 years, and it's been a day now. It hasn't come back. Do you understand what this means to me? And I'm like, wow, this is really fascinating. I didn't expect a result this fast, quite honestly.
Right.
But it happened in her case. She's been a patient of my practice for 4.5 years. The buzzing the ringing in the ear has not come back. And what's very interesting, she had lost about 70% of her hearing, but now she has gained about 40% of it back. So
huge.
It's huge.
And there is some links with tinnitus and inflammation.
Exactly.
And then in the case of a root canal, which basically you are putting your own body through a mild form of almost sepsis, right?
Exactly.
It's like you're leaking this bacteria, this toxins into your body, you're slowly poisoning it. That, in a way, could be linked to inflammation, which could be linked, in her case, to this ringing in the ear.
Absolutely. So this was one of the success stories that even her own physician called back and said, what happened? What did you do? I'm like, nothing. I thought like the root canal is causing it. So we enrolled her. It didn't take much enrollment, actually. She's like, let's do it. And we actually removed all her root canal teeth. She feels much better. She got 40% of her hearing back. She's not back to 100%. Who knows? She may recover even more. But this is the thing. The damage, depending how much damage it has been happening throughout these years, either people can recover fully or their symptoms can significantly improve. But if you have significant damage, no one can say, okay, after so many years, if we remove this tooth, you're going to go back to a complete normal human being. But there is going to be significant improvement. If you're not fully recovered, there's going to be huge improvement. In her case, she's very happy. Every time she sees me, she gives me a hug.
That's
and
incredible.
It's like, you changed my life. So that was one story. And another case study I had was this gentleman was a very healthy 40-year-old. He used to run every day. He was part of a band. He was a musician. And he gets a root canal done after so many years, suddenly starts having some symptoms of brain fog, chronic fatigue, and then this starts to escalate. He has palpitation of the heart, goes from one doctor to another. They do all sort of examination. You're a healthy young man. His nutrition was up to date, great diet. It's like, what's going on? No one could figure out. It got to a point that 10 years later, he could not leave his bed. Literally, he could not even go to restroom. Sometimes he said that was agony. He had no energy, chronically fatigued. So he comes and we take a look and see he has only one root canal tooth. So obviously now he's working with an alternative medicine doctor. They're doing all sorts of chelations, tests. And the only thing I can think of is like, okay, you have one root canal tooth. The best I can do, I can tell you, okay, yes, there are toxins, there are this, there are that. Are you ready to remove the tooth? Fortunately, it was a back tooth. He's like, get rid of it. We get rid of the root canal tooth. Again, it was a team of doctors. It wasn't just me. I'm not taking
everybody having a piece of the puzzle.
Coming
together.
I
and
do
saying,
my
what can we
part,
do?
what I do exactly. But we are correlating. We're talking constantly with one another. So he's still very much the patient of the office. He's got his energy back. He goes running every day. He had quit his job, unfortunately, for a few years. Now he's back as part of the band, and he's a totally different person.
Incredible.
And all of that because of some alternative medicine and
functional dentistry, biological dentistry.
You know?
Don't be modest. That seems like it was a big part of it, at least in his case. And I think that that's what people are looking for. They're looking for both the hope if they're in that situation, but also, I've never had a root canal, and I don't want to have one in the future. I want to avoid it, right? And people who are listening who have never had that, to be just aware of the different ways that we can have these insults that happen in our body that lead to exactly what these case studies are that you talked about, unexplained sort of mystery illnesses that are there.
Right. And the last case that I want to share with you, because it's very common, is people with chronic sinus infection. We had a gentleman who, again, was referred through one of my alternative medicine doctor. He's been taking antibiotic on and off for 10 years. His nose was always blocked. Sinus pain, one ENT after another, they couldn't help him. He, any procedure they would do, they would give him a little remedy, short period of time, it would come back. So he had that going on for almost 15 years. So he says chronic sinusitis. So when he came and we take a look at his teeth, I noticed he has one root canal on the upper left, and interestingly though, he had an extraction done on a wisdom tooth on the upper left. And I asked him, with the two-dimensional x-ray, once again, is not good enough for me to give you proper diagnosis. So you need to do a CT scan. So I sent him to a center that I trust. He did a CT scan. He came back with the result. And I'm like, oh, that's interesting. Whoever did the extraction on the wisdom tooth poked through the sinus. There's a sinus communication now with the oral cavity and your sinus. So it's wide open.
So whatever's in the mouth is making its way into the sinus, including all the bacteria that's there.
Exactly. And then his root canal actually does not look good. And the CT scan revealed that the upper left sinus, where the wisdom teeth was extracted and the root canal tooth still exists in the patient's mouth, is the one that is more damaged. It's filled with fluid. It's very dense. The mucosa is dense as opposed to the other side. So I tell the patient, share my information. He decides, I see what you're talking about. Yes, I remember that extraction. I was symptomatic for some time afterwards and this and that. I was put on antibiotic for a number of times. And he agreed that let's remove the root canal tooth. So we removed the root canal tooth, and I contacted the ENT that I trust that kind of is in tune with functional medicine as well, that they don't see black and white. I shared my CT scan with him. So when he saw the CT scan, he's like, oh, this is pretty amazing. This is good stuff, Rosie. I'm like, yes, it is good stuff. So he did sinus surgery on him. The patient for the 2.5 years has not been on antibiotic. He breathes through his nose. All of the pain is gone, and he's clear after 15 years of having chronic sinus infection with no sinus issue.
Incredible.
So it's amazing.
I mean, those stories have to make you feel great, right?
It really does, and it makes you. It really does. I can't say enough. So you're making a difference in people's life, and more so, you become more and more of a believer of what you're doing does have a positive impact.
Exactly. And it's just another reflection of the fact that an open-minded practitioner that you work with, even if there's not, I already talked about this example, but I just want to share one more thing. All this awareness around the breast implant illness example that I shared previously, it all started from women going on Facebook and creating these groups and sharing their symptoms and what they were going through. And every doctor, every person that they were talking to, unless they were holistic, was like, you're crazy. There's no proven anything. Breast implants are safe. It's all good. The industry said it's fine. We've done studies. This is the classic story. We've heard this time and time again. But if people are suffering, something is going on. That doesn't mean it's a causation, but there's some link that's there. And then finally, some open-minded physicians, people, holistic practitioners paying attention and asking the right questions and saying, look, there is some reason to be cautious. There's some cause for concern. If you're open, let's address this issue. And that's exactly what you're doing in this instance, even if there's not big studies, which I hope one day there is. Whoever's listening and wants to fund that, go to town. Until then, finding somebody open-minded who will walk down the path with you and help you explore this is so key, and really the only thing that gives so many people who are suffering hope.
Absolutely.
Hey YouTube, if you like this video all on cavities and how to prevent them naturally, you're gonna love this video on doing the same with cancer with Dr. Jason Fung.
All that programming in that single-celled organism to grow, to move around, to become immortal, that's all there. That was never in